No fewer than 1,000 persons in the Paze community, a suburb in the Federal Capital Territory, benefited from the medical outreach organized by the National Association of Seadogs, Zuma Deck. Speaking at the occasion, the Capoon, Zuma Deck National Association of Seadogs, Nnamdi Eze, who attributed the gesture to part of the association's corporate social responsibility, also hinted at collaboration with key stakeholders to bridge the gap in the healthcare delivery system, especially to the rural communities in the country. Speaking on the theme of the outreach tagged The Village Doctor, the Capoon said it tends to provide medical assistance to the rural communities in view of the current economic realities.
We identify communities without a strong hospital presence. We understand that the cost of medical care is very prohibitive at a time in Nigeria where families are struggling to feed, families are struggling just to make a living. Then you can imagine what medical care entails. So this is our means of intervening.
On his part, the National Coordinator Green Strides Development Initiative, Assy David, emphasized on the importance of prioritizing the health needs of the less privileged in vulnerable communities, who mostly fall prey to the challenges in the sector.
We decided to go to the rural areas because they are the ones that are deprived. They don't have access to all these basic amenities, and health challenges in the rural communities in the whole country is a big problem. That's why we decided that we should partner with NAS to be able to impact on the less privileged and vulnerable communities. And that's why we picked up this medical outreach. It's very important for the health of the inhabitants of the community.
The medical mate Zuma Deck, Ike Osinachi, who gave a breakdown of the medical care provided, urged the government to be consistent in the provision of quality health care to disadvantaged citizens in the rural communities.
Wherever we find ourselves at this particular kind of mission is particularly to bridge the gap, in healthcare delivery, from what government is able to offer to these communities and what they are not getting at all. If you look around, you see that, as we moved towards this community, you see that we had no health facility inside. So NAS particularly identifies communities like this where you may unlikely find health facilities on ground to take, healthcare services to the people, so that they could, get well, have to assess what those who are in better, rural environments are also assessing.
The National Association of Seadogs, popularly known as the Pyrates Confraternity, was founded in 1952 with the agenda to support human rights and social justice in Nigeria. Palang Bukar, CNN News.